The Buteyko method is a special system of exercises and education done correctly that teaches people how to correct their all-the-time breathing. Now, correct breathing at rest is nasal, gentle and quiet, day or night, awake or asleep. Hello, I'm Brian Firth. I am a BIBH trained Buteyko practitioner, and for 11 years I have taught over 6,000 people, little kids from 5 to adults of 95, how to correct their breathing using the Buteyko Institute method. And I'm going to try and give you a quick 6-minute overview. Now, what most people are not aware of these days is that people's breathing changes. Just like people's weight, people's fitness, people's flexibility, your all-the-time breathing can become gradually and permanently incorrect. All people who snore have poor sleep, such as apnea, insomnia. People who wake unrefreshed have chronic nasal or sinus congestion. Those that mouth breathe find that their body has come to gradually and permanently breathe incorrectly. The same goes for people who get asthma, have panic attacks, and who are tired and sleepy during the day. Now, there is a lot of misinformation out there about breathing. For example, I can't think of any good reason why anybody should take a deep breath. But yet, how often do we hear this? Deep breathing is not correct physiological breathing. Let me explain sleep problems. Now, the purpose of sleep is to restore, or if you like, recharge our bodies. Yet people often wake unrefreshed and can be tired and sleepy during the day. So what happens is when people overbreathe, such as mouth breathing at rest, walking, talking, sleeping, or any kind of stress, being busy, actually causes your breathing control to become gradually more incorrect. When it gets around 3 times what is normal, most people are still unaware. They walk around during the day and perhaps their lips are open and they don't consider this a problem. But when we lie down at night, this increases your breathing, and then when you fall asleep, you breathe the way your body has come to breathe, and for many people their mouth comes open while they sleep, whereas it never used to. Now, this heavy, incorrect breathing is noisy, and this is what we call snoring. If you snore, you can probably look back and see in the past there were less complaints because your breathing has gradually got worse. Now, snoring is just like blowing a whistle. You blow gentle, it's not very loud. You blow hard, of course it is. Now, the real purpose of breathing, of course, is to get oxygen to your whole body. And when you're not breathing correctly, your body is getting less and less. And soon your body is going to take action and try and stop you by blocking noses, sucking the airways closed at sleep. This is called sleep apnea. Insomnia, trying to keep you awake. And for some people, approximately 1 in 12, they get asthma-type symptoms. Now, this sleep disturbance, of course, erodes the quality of your sleep, and people can wake unrefreshed and sometimes be tired and sleepy during the day. It can affect your blood pressure and really strain relationships and affect the quality of your life. Now, modern medicine tends to treat all these conditions separately and symptomatically only. Drugs for asthma and nasal problems, sometimes surgery, and for sleep, it's sleep studies, and they want you to wear CPAP masks to sleep for the rest of your life. Now, there's nothing wrong with symptomatic treatments. We all need a bit of painkiller from time to time. But if we rely only on symptomatic treatments, you can really never get better. Now, what I offer is a breathing retraining course, a clinically proven method which teaches you through gentle breathing exercises and a fair bit of education, how to reset your breathing, your all-the-time breathing back closer to normal, which at rest is gentle and quiet, awake or asleep. The Buteyko method applied correctly is famous throughout the world as a natural asthma treatment to improve allergies and hay fever. Over 90% of asthma sufferers show significant improvement within a week of starting the Buteyko course. Now, when it comes to sleep, our experience with working with thousands and thousands of people is that improvements in sleep usually happen within days and consolidate within weeks. When snoring and apnea no longer occur, confirmed if you like by a repeat sleep study, CPAP machines are no longer required and surgery can be avoided. Many people we work with do not find CPAP or dental appliances tolerable or successful, or they just do not want to wear them for life. The Buteyko method, taught correctly, provides maximum relief of symptoms with the minimum use of medications and devices. You will be surprised how many other conditions are affected by your incorrect breathing. Call or email me to discuss your conditions. You can get more out of the rest of your life.